Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening, hoping that you had a fantastic weekend and hoping the start to your week on this Monday has been treating you well. If this is your first time listening to us, my name is Christian Brindle. I own a company called Christian Brindle Insurance Services where we work with people just like you on their Medicare. We partner with all of the largest insurance companies in the insurance industry. And every single week, we work hard to make sure that we bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And today we're going to talk about something that I was actually really looking forward to kind of diving right into because I am just such an insurance nerd. I am so into this stuff, and I've said this before on this platform and I'll say it again. I always hear from people in the industry, other brokers and things like that, that people on Medicare do not want to be an expert on Medicare. They don't care about the stuff that I care about or other people might care about. And I do think to a certain extent, there is some truth in that. But I think that a lot of the people that say that would be very surprised at how many people are interested to kind of know as much as possible. Because the more you know about the inner workings, the more you know about the things behind the scenes, the more you know, the more you can maximize your Medicare and get the most out of it, right? I mean, the more you know about anything, the better equipped you are to utilize it to your advantage. And this is a topic that I've been wanting to talk about for some time. I actually had been really kind of fighting to get some representatives of my home state for Regents Blue Cross Blue Shield to come on and kind of do a collaboration episode with me where they could kind of explain this stuff better than I could because they work for the company. But what I have found is, and we've done a lot of guests come on this show and this podcast, but people that actually work for the insurance companies are terrified to do a show like this. They're terrified! And do you know why? It's because they don't know what they're allowed to say and what they're not allowed to say. They don't want to get in trouble from their company. And so they're just scared to come on. And they've told me that. A lot of them have told me that. They think they're going to say something that breaks a compliance rule or something like that. There's so much gray area on what these people are allowed to talk about, what they're not allowed to talk about, what they're allowed to do, what they're not allowed to do. I mean, if anything, I think it would be good promotion for their company, right? I mean, this is a podcast that will be heard in all 50 states, has a huge audience, will get played over and over and over and over again for years to come. I don't know. I just, it doesn't matter. I know where they're coming from, I suppose, and no hard feelings, but I just think it would have been a very, very captivating, interesting episode if we actually had somebody from one of the Blue Cross Blue Shield companies come in and talk to us about this today. But they're not going to do it. They're scared. So you just get me. And I'm not scared of anything. And I have a very interesting relationship with Blue Cross Blue Shield, especially our local one here. Now, there's a lot of different Blue Cross Blue Shields, and that's something that we'll get into in a minute here. But as many of you know, I'm a second-generation Medicare specialist. My dad before me was and has been a Medicare health plan specialist and expert since the late 80s and early 90s. My dad just got a Medicare himself last year, but in the 90s, and in the early 2000s, my dad was at least number one, if not number two, as far as, you know, writing Blue Cross Blue Shield policies for Blue Cross Blue Shield of Utah in our home state here in Utah. And he was number one or number two for, probably over 10 years. And so because of that, when I was growing up, I was always, around, executives with the insurance company. I was around people in high places with the insurance company. There's a lot of people today that work for Blue Cross Blue Shield here locally, Regents Blue Cross Blue Shield, that have known me since I was a little kid. And there's people that have gone off to work for other insurance companies, but they know me because they knew me when I was a little kid when they worked for Blue Cross Blue Shield. And so the insurance company kind of always has a special place in my heart. I mean, I remember when I would go to school and, we had Blue Cross Blue Shield everything in our house, because they were my dad's, number one company at the time for many, many years. And so, I'd go to school and all of my school pens would be Blue Cross Blue Shield pens. I'd have Blue Cross Blue Shield notebooks and everything like that. And the other kids were like, what in the world? What is this? That's not cool, Blue Cross Blue Shield. Looking back on it, I think it's very cool, but I'm a nerd about this stuff. So one thing that people have always asked over the years is, why are there so many different Blue Cross Blue Shields? And are they separate? Are they all one company? How does this work? Now, Blue Cross Blue Shield has something on their website, essentially, where they kind of dive into this. So I'm not scared to do an episode about this because this is on their own website for the public to view. So if they can put it out publicly, I can talk about it on the podcast, right? I mean, that's just common sense. I mean, there are so many rules and regulations, and no one really quite knows what you can say in the Medicare industry. I very much push the boundaries. And especially with this podcast, there's no regulation for the podcast. Now, there are some things I can say that is just a clear-cut no. And I try to walk on eggshells as much as I can with that, but this should be a no-brainer. Okay, so if we get a talking to about this one, I'll just throw my hands up in the air and I'll just be like, I don't know what to do at this point. But I'm going to take the risk. So Blue Cross Blue Shield is very interesting. There's a lot of different Blue Cross Blue Shield companies. Of course, the most famous one is Anthem Blue Cross Blue Shield. It's probably the largest Blue Cross Blue Shield company, but all the Blue Cross Blue Shield companies are connected. They really kind of all fall under the Blue Cross Blue Shield umbrella. And a lot of them are just, like, for example, in Alabama, there's Blue Cross Blue Shield of Alabama. In Alaska, there's Primera Blue Cross Blue Shield of Alaska. Obviously, in my home state, there's Regents Blue Cross Blue Shield, which is also in Oregon. It's also in Idaho. It's also in a couple of different places. 4 states, I believe, is what Regents falls under. So there's all these different Blue Cross Blue Shields. Colorado has Anthem Blue Cross Blue Shield of Colorado. California has Anthem, very, very well known. They also have Blue Cross of California. So there's so many different Blue Cross Blue Shields. In Florida, there's Florida Blue, Blue Cross Blue Shield of Georgia and Georgia, Blue Cross Blue Shield of Hawaii and Hawaii. In Idaho, they have Regents Blue Cross Blue Shield of Idaho, but they also have Blue Cross of Idaho. There's 2 different ones there. So how does this work, right? How are they all connected? Well, essentially, they act as different insurance companies, but they also act as they're connected as far as the insurance companies go. It's a very, very interesting dynamic and very unique to them, something that they probably do that you don't see really any other insurance company do. I'll talk about it more after I take a break, hear from this week's sponsor. Don't go anywhere. I'll be back. I'll tell you exactly how this works to the best of my understanding as a Regents Blue Cross Blue Shield agent of Utah, Idaho, Oregon, and other areas. Don't go anywhere. I'll be right back. Welcome back, everybody. Thanks so much for sticking with me through that break. Now let's talk about some Blue Cross Blue Shield companies. So we kind of talked about in segment 1 a little bit about how there are so many different Blue Cross Blue Shields. I mean, I could go on and on and on and on and on. New York has Empire Blue Cross Blue Shield. They have Blue Cross Blue Shield of Western New York. They have Blue Shield of Northeastern New York. They have Excellus Blue Cross Blue Shield. There are so many different Blue Cross Blue Shields. Now, according to their website, this is how they explain it. The 36 independent and locally operated Blue Cross Blue Shield companies deliver health insurance coverage to 1 in 3 Americans across all 50 states, the District of Columbia, and Puerto Rico. In addition, the Blue Cross Blue Shield Federal Employee Program insures over 5 million federal employees, retirees, and their families. Our coverage also extends to individuals and employers who live, work, and travel internationally, and to those who travel to the United States. So there's 36 different Blue Cross Blue Shield companies, according to their website, and they are all independently and locally operated based on specific areas, but at the same time, they're also connected. It's a very, very interesting dynamic. But for example, in my home state, Regence Blue Cross Blue Shield is not the same as Anthem Blue Cross Blue Shield in Colorado or California. They're connected. They fall under the same umbrella, but they're ran by different people. And that's very hard for people to kind of wrap their head around because you don't usually see that. You typically see, let's say there's 2 different insurance companies that are owned by one big insurance company, but they're all part of the same family. This is sort of like that, but they're almost like they're different companies too. They fall under the same umbrella, but they do things differently. They have different processes, and they're not necessarily the same insurance companies. It's very, very fascinating, but they are, in fact, very different processes, but they fall under the same umbrellas. So a policy you have, let's say, from Highmark Blue Cross Blue Shield of Delaware is not going to be the same as Florida Blue in Florida. It's very, very fascinating. They're kind of all on their own, and they do their own thing, and they do things differently than, the other companies, but they're all under the same umbrella, and they all have some kind of similarities, and they kind of all share that brand, Blue Cross Blue Shield of whatever, Also on their website, they say, since 1929, Blue Cross Blue Shield has led the healthcare industry by rising to the challenges that brings enabling new discoveries and continuing to evolve. So basically, Blue Cross Blue Shield started in 1929, and over the years, they have essentially just kind of popped up in different regards. There's different Blue Cross Blue Shield organizations, and they've grown. They've definitely grown. They've very much become a powerhouse, but it's also a little different. It's also a little difficult to kind of calculate because they all are locally independently operated, but they all do kind of fall under that umbrella, if you will. But yes, it also says on their website, today with growth, stability, and innovations, Blue Cross Blue Shield continues to be the name generations can count on, as they have for more than 80 years. So what I can say is just understand they're connected. They all are under that umbrella, but they do have a lot of key differences amongst themselves, from one Blue Cross Blue Shield company to another Blue Cross Blue Shield company. I've had people that have, moved from North Carolina or North Dakota or California, and they've had these different Blue Cross Blue Shield plans, like they might have Anthem from California, Blue Cross Blue Shield. I've seen that several times, but they'll move to Utah and they can get a better Blue Cross Blue Shield plan with Regence Blue Cross Blue Shield here in their particular situation. And so we're able to replace their old Blue Cross Blue Shield policy with this new one. And it's something that, it's no different than if they were switching to a new insurance company completely, because they have to cancel the old one, they have to get approved with the new one, and it's it's almost like they're competing companies, but they're really not, I suppose. It's an interesting dynamic, and I think there's a lot of uniqueness there to them because I don't know of any other insurance companies, like I mentioned, that really operate that way. Now, like I said, I have a lot of connections with our local Blue Cross Blue Shield company here in Utah. I know a lot of people that work for them. I grew up around that company, essentially. I remember being 10 years old at a, executive dinner kind of thing at a resort in Park City. 5-star lodge and hotel, because my dad, who's a very important person for them at that time, was invited. I remember them taking us to Jazz games when I was a little kid. The Utah Jazz NBA basketball, our local team here in Utah. And, they would give us, now this was a long time ago, but they don't really do this kind of stuff anymore, but they would, we would have, box seats, would be in a box, private areas for Jazz games. I spent a lot of time around people from Blue Cross Blue Shield when I was a little kid, when I was coming up, when I was, growing up. And I think they're a very interesting insurance company. I think they have gone through a lot of evolution over the years in different ways. They're not exactly the same as they were when I was growing up, but some things good, some things not so good. It just kind of depends. But this is a topic that we get asked about, talk about a lot, and I really wanted to talk about it sooner. And the reason why it took us so long to kind of really do this topic was simple. I wanted to have someone that worked for one of the Blue Cross Blue Shields come on and talk about it themselves. I thought it'd be really interesting. I thought they'd know probably more about it than even I do because they work for the company. But they're just so spooked. They are just so spooked. They don't know what they can say. They're afraid about getting in trouble or getting the company in trouble. I mean, it's kind of a mess, to be completely frank with you. And it's not just them. It's any insurance company representative I've asked to come on and be my guest. The people that are willing to come on are people in the insurance industry that are not employed by, I guess, an insurance company, I guess. Politically correct kind of stuff, which is fine. One of these days, I think we'll be able to get some people on. We got a lot of connections, got a lot of good relationships with people in various different insurance companies. I think it'd be great to have them come on and kind of listen, from a perspective of someone on the inside. Not necessarily, we partner with these insurance companies, but we're not at their offices in their buildings working for them as an employee each and every day. We know a lot more about what goes on the inside than someone that, has no affiliation with them, but we can't give as much interesting detail, I don't feel, as someone that works for them. So there's that. I'm going to take a break, my last break, hear from our last sponsor. I'll be right back, have some final thoughts about this, and then I also wanted to talk about what will be going on going forward. Don't go anywhere. I'll be right back. Welcome back, everybody. Thanks so much for sticking with me all the way to the end here. Do I think Blue Cross Blue Shield's a good, bad, indifferent insurance company to deal with? I can't tell you that on here. That's something that's an example of what I mentioned earlier is a no-no. I have to be no comment. I cannot publicly say if an insurance company is a good company, a bad company. What I can say is interesting to kind of know about how they do operate a little bit. And we will leave it at that. Folks, we're going to continue our 3 podcast weekly schedule. We have no intentions of changing that or anything of that sort. If you're not subscribed already to our YouTube channel, right now, the YouTube channel has been probably the slowest growing thing that we've done associated with the podcast. Now, Apple Podcasts, Stitcher, iHeartRadio, Pandora, Google Cast, everywhere that the podcast is listened to, and whichever platform you're listening to it on right now, has gotten a tremendous amount of traffic, lots of listens, lots of support, and we love you for it. We really appreciate it. But if you're not subscribed to the YouTube channel, I really highly encourage you to do that, because I really believe that you're missing out on a ton of good information we put out that isn't shared on the podcast. We do videos. Of course, the podcast goes up on the YouTube channel in video format. So if you ever wanted to watch it while, gazing into my eyes while I talk, I don't really make a lot of eye contact with the camera. I'm a little uncomfortable being on camera, but whatever. But let's just say you wanted, more content, more information that is separate from the podcast. We do separate videos, YouTube videos. The channel's called Christian Brindle. It's my cartoon face of myself when I started. That's what the logo is of our organization, Christian Brindle Insurance Services. That's the picture. We've got about we've got about a couple hundred subscribers at this point. We just really started taking the YouTube channel seriously in the last 6 months. So, but our goal is to make sure we have a video come up every day. It might be a podcast episode. It might be something else completely. We've been doing videos about, certain topics of if Medicare covers it or not. Wheelchairs, that kind of stuff. We're doing, and we also talk about how it's covered. We did a video recently where we ranked the best Medicare supplement Medigap plans, in my opinion, in 2020 going forward, and why. And we've just tried to do a lot of good information. We did one about HMO plans versus PPO plans, the good, the bad, the ugly, which one's best, whatever. Which if you've listened to me for some time, I would never actually say which one's best, but I talk about their strengths and weaknesses. And I think it's dependent on situation, of course. But yeah, I highly encourage you, head over to the YouTube channel. If you're not subscribed to it already, subscribe to it. There's a lot more information there in addition to what we do here on the podcast. I'm not saying you should not listen to the podcast. I'm saying that you should be tuning in on both platforms, on this platform, but also on the YouTube channel, because we're really cranking out a lot of great videos there that I'm really, really proud of, and I'm really excited about what we're doing going forward. Thanks so much for listening, folks. We're going to be doing our regular episode on Wednesday, and then on Saturday, I will be having Randy W. Hall. You know him well. We partnered with him during the open enrollment period. He's on a different part of the country than we are, but he's going to be coming on, and we're going to have a really, really fun episode with him that will air on Saturday, so you're not going to want to miss that. Thank you so much for your time. Thank you so much for spending a little bit of your time with me. As always, folks, if you haven't done so already, it really helps us out so much to leave us a good review. It helps us reach more people just like you. If you've enjoyed this podcast, if you've gotten a lot out of it, please do us a favor. If your platform you're listening to us on allows it, please leave us a 5-star review. It helps us reach more people just like you that need to hear this information desperately. No one's putting out information in the intimate style and format that we're doing. And I'm proud of that. I think that we can really change the Medicare industry for the better. Take confusion out of it. Take sleazy sales tactics out of it. Take the industry, the insurance companies, a lot of brokers and agencies that, just tell you what they think you need to know. And they pretty much completely manipulate what kind of plan you're going into that fits their own personal desires instead of what you need. They can't do that if you're educated. And this podcast is one of the very few things I feel, we're not the only good organization or person out there that puts out good information that has this goal, but we're one of the few. Help us reach more people just like you. We don't charge anything for the podcast. It's just information. We're going to continue to pump it out. Thanks so much for listening. We'll be back on Wednesday. Have a wonderful Monday and a wonderful start to your week. Take care.